Welcome to Study Session 9, Prenatal Health Education and High Vaginal Swab. Introduction. The midwives play a significant role in the process of providing patient education during pregnancy. A pregnant woman, especially the first-time mother, may have many questions and concerns about this period in her life. Much of the information she may have is probably inaccurate or incomplete. You as a midwife must provide accurate and complete information. This information includes personal and environmental hygiene, diet in pregnancy, preparation for labor and delivery, immunization, as well as family planning. In this study session, you will learn about prenatal health education, the definition of high vaginal swab, the objective of this procedure, as well as the equipment needed for this procedure. Learning outcomes. When you have studied this session, you should be able to 1. Highlight the types of education for prenatal clients preparing for parenthood. 2. Discuss diet planning. 3. Outline the various topics for prenatal planning. 4. Discuss the concept of high vaginal swab. Types of education for prenatal clients preparing for parenthood. Individual teaching and counseling, information groups, discussion or counseling groups, and prepared childbirth groups are the types of education that are presented in this study session. Individual teaching and counseling. 1. One-to-one teaching. This type of teaching is used in all nursing settings. It teaches on an individual basis as needed. One-to-one teaching is beneficial in teaching patients to understand and to adapt to health problems with pregnancy. 2. Counseling. This entails an interchange of opinions and giving of advice. It is more personal and feeling-oriented. When counseling is used in combination with facts, it enhances learning. It takes into account the patient's feeling. B. Information groups. 1. These are planned groups to serve everyone in the community. It provides information on the physiology of childbearing, general hygiene, nutrition during pregnancy and lactation, preparations for the baby, and care of the mother and baby after delivery. 2. Methods of presentation include lecture, films and slides, questions and discussions, and tours of appropriate areas, labor, delivery, newborn, and postpartum. 3. These groups are organized by the American National Red Cross, the YWCA, Public Health Department, adult education programs at community schools and colleges, hospitals, and groups of physicians. C. Discussion or counseling groups. 1. There is no structured curriculum for this type of teaching. Discussion is developed from the contributions of group members. The group leader must be knowledgeable and able to discuss all topics concerning obstetric and newborn care. 2. This type of instruction has the advantage of not limiting the discussion to certain topics as done in class groups. It allows for more participation and involvement by the parents. Remember, it takes a highly qualified individual who is good at listening, but who is also capable to keep the discussion going. D. Prepared childbirth groups. This is a form of informational instruction, but includes active participation by the group to prevent the fair tension pain mechanism of labor. It is designed to eliminate fear during pregnancy. Facts, thoughts, concern. Anatomy and physiology of childbearing. Appropriate care for the pregnant woman. Sensations likely to accompany labor. Methods to work cooperatively with the sensations. Exercises to strengthen muscles in labor. Breathing techniques to develop relaxation during labor. Needs of the baby after birth. Information about growth and development. Diet planning. A diet is considered as the clothing and supplies needed to care for the infant following birth. Parents in classes are encouraged to prepare for the infant's arrival before birth. Baby showers are usually given by the family and friends to help provide some of the necessary items some clothing and care items are taken to the hospital to bring the infant home. It is important to remind new parents that infants grow quickly. Encourage them to not buy a lot of newborn items. Infants outgrow clothes very quickly, and in some cases, the clothes are never worn. Principles of proper nutrition. Good nutrition. Good nutrition during pregnancy is essential for the well-being of the mother and the developing fetus. Development of effective uterine musculature. Development of breast tissue. Development of an adequate functioning placenta. Poorly nourished mothers have placentas with fewer and smaller cells. Also, poorly developed placentas have a reduced ability to synthesize substances needed by the fetus to facilitate the flow of needed nutrients and to inhibit passage of potentially harmful substances. Development of infant's weight, length, bones, and brain. A nutritionally deprived fetus may have decreased development of brain cells. If optimum nutrition is provided after birth, the effect on the brain may be reversible. Continued development of the infant after birth. Chronic malnutrition. This has been shown to be related to reproduction problems. This includes difficulties during pregnancy, labor and delivery, increased perinatal mortality, low birth weight, and other problems with the newborn baby. Nutritional risk factors in pregnancy that require observation. Risk factors at the onset of pregnancy. A. Adolescence. Many adolescents are nutritionally at risk due to a variety of complex and interrelated emotions and social and economic factors that may adversely affect dietary intake. Their nutritional needs are greater and pose much concern from nurses and physicians. Frequent pregnancies. These pregnancies may have depleted nutrient stores. This situation can compromise maternal and fetal health and well-being. Poor reproductive history. Previous poor weight gain, pregnancy-induced hypertension, previous stillbirth or small for gestational age baby, premature delivery, and prenatal infection are all common in women who are or have been poorly nourished in the past. These women may need more than the usual nutrition guidance. Economic deprivation. This refers to the pregnant patient who is not able to afford proper food. There are several programs that help with the purchase of food or that offer supplements. Bizarre food patterns. This includes faddish diet. A woman may enter pregnancy either having or continuing to be on a faddish or otherwise nutritional inadequate diet. Vegetarian diet. This diet may not contain any or enough protein or vitamins for a developing fetus. Intense nutritional counseling will be required to work out a diet pattern during the prenatal period. Smoking, drug addiction and alcoholism, physiologic problems may have been present. Pregnant patients who indulge in this category may have physiologic problems. There is a possibility that the patient may not consume sufficient quantities of nutritious foods and in addition can cause major problems to the fetus. Chronic systemic disease. There may have been medical problems which may have interfered with ingestion, absorption, or utilization of nutrients. Drugs used to treat these conditions may also affect nutrition by similar interference. Counseling should include general nutrition guidelines for prenatal care and diet therapy. Pre-pregnant weight. This may be at risk if the patient is 15% or more below or 20% or more above the standard weight for health. Risk factors identified during pregnancy. Anemia of pregnancy. Many pregnant patients have a lack of iron stores large enough to meet the needs of pregnancy. Pregnancy-induced hypertension. This may be seen in more patients with poor diet. However, there is no definite documentation of PIH's relationship to the diet. Inadequate weight gain. This may be an indication of material and fetal malnutrition. Intrauterine growth retardation. It is important to document the pattern of weight gain in pregnancy as well as the total amount of weight gained. Excessive weight gain. This may be due to fluid retention. However, the pregnant women should be carefully assessed for PIH. Caloric requirements of pregnancy. Daily caloric requirements for a pregnant woman are about 300 more than their normal requirements of 2,300 to 2,700 calories. The exact requirements are dependent on the patient's age, multiple birth, and the patient's activity. Calories should be selected for quality rather than quantity. Empty calories do not count. Menu planning. A diet consisting of a variety of foods can supply needed nutrients. The increased quantities of essential nutrients needed during the pregnancy may be met by skillful planning around the basic for food groups. The recommended daily intake from the basic 4 food groups as follows. Milk group 32 oz or 1000 ml per day. Meat group 4 servings per day to include beef, veal, pork, poultry or fish. Eggs each day. Liver once a week. Vegetable and fruits group 2 servings daily of dark green or yellow vegetables. 2 servings daily of fruit. Bread and cereal group 4 servings per day. Cravings during pregnancy. Craving. This is a strong desire for a certain type of food, usually carbohydrates. Pica. This is an intense craving for and ingestion of non-nutritive substances such as clay, laundry starch, rubbed flour, and rice. This type of craving is characteristic of, but is not limited to, lower socio-economic groups, ethnic groups, and regional areas, which prefer certain substances. Even though the cause is unknown, it interferes with good nutrition. Pica appears to be related to iron deficiency anemia as either a cause or an effect. Treatment or counseling. Anything that depresses good nutritional intake should be evaluated. This type of depression may be caused by nausea or vomiting, food fat or lack of finances, smoking or alcoholism, or personal and social problems. If a problem is identified, it should be reported to the charge nurse or physician for appropriate referral to the correct people who can relieve or eliminate the problem. Total dietary intake on a daily basis may need to be assessed. Dietary needs of pregnancy should be reinforced at every visit to the doctor. Obesity. Obesity is common and frequently a serious problem among Americans. The patient is considered overweight if she is 10% above her desirable weight for their height and age group. If the patient is 20% over her desirable weight at the beginning of the pregnancy, she is considered at risk. These patients require close observation and additional education. The most frequently prescribed diet is 15 to 18 calories per day. The patient must be divided that this is not the time to diet to lose weight. Encouragement is greatly needed during the pregnancy. Teratogens. A teratogen is an agent or factor that causes the production of physical defects in the developing fetus. Many drugs are known to have teratogenic effects on the fetus if taken during pregnancy. Drugs are the most widely recognized cause of structural defects in the developing fetus. Patients need to be cautioned about taking any medication without a physician's approval. Over-the-counter medicines such as nose drops, cold remedies, and sleep medications may cause problems. Examples of known effects are physical abnormalities, no arms or legs, hemorrhage or jaundice, neurologic symptoms, abnormal dental pigmentation, addiction, vaginal malignancy, or altered sperm causing infertility. The effects of many drugs may not be known until later years during the growth and development of the child. Teratogenic drug examples: teratogenic viruses and parasites, herpes simplex, rubella, toxoplasmosis, This is transmitted by cat feces and raw meat, influenza or viral infections in the early weeks of pregnancy. Other teratogenic conditions: hyperthermia, maternal disease, maternal malnutrition, environment pollutants, lead increase in maternal age, tobacco and alcohol. Preparation for labor and delivery. Relaxation and psychological control of pain. Several methods of relaxation and psychological control of pain during labor are listed below. Lamai's method. Psychoprophylactic method. This method is the most widely taught. It deals with combating the fears associated with pregnancy by teaching relaxation and breathing techniques. The patient is taught to replace responses of restlessness and loss of control with more useful activity. The patient is taught to respond to pain with respiratory activity and relaxation of uninvolved muscles. The patient is taught controlled breathing and mind focusing techniques. The partner is taught to help the patient stay in control. Bradley method, husband-coached childbirth. This is similar to the Lanez method. Emphasis is placed on slow, deep breathing along with complete relaxation. Women using this practice often appear to be asleep during labor. However, they are not asleep, but they are simply in a state of deep mental relaxation. Hypnosis. This is an induced state of extreme suggestibility in which the patient is insensible to outside impressions except the suggestions of her attendant. Signs of approaching labor. These signs of approaching labor are taught to all patients. When the patient notices them, she is aware that labor will be forthcoming. The signs are lightning. This is the descent of the fetus into the brim of the pelvis. Lightning occurs in the last 10 to 14 days of pregnancy. In a primigravida, it may not occur until actual onset of labor. In multigravidas, the patient identifies it as being able to breathe easier. False labor, Braxton-Hicks contractions. This is intermittent uterine contractions occurring at irregular intervals, which serve to tone the uterus. Show. This is when the blood-tinged mucoid vaginal discharge becomes more pronounced and red as cervical dilatation increases during labor. Burst of energy. This is an increase in energy level. It occurs approximately 24 hours before onset of labor. The patient should be advised to relax during this time, since labor will be starting soon. Rupture of membrane. This occasionally may be the first sign. Due to the risk of the prolapse cord, the patient needs to be aware that she should come to the hospital immediately even if she is not having contractions. If the membranes rupture prematurely, it then becomes a complication. Frequent urination. This again becomes a problem in the last stage of pregnancy. Pressure on the bladder is due to the enlarging uterus and the head settling back into the pelvis. Steps in giving prenatal education. Greet and introduce yourself. This will give room for creating rapport with your client. Inquire of your client's well-being. Introduce the topic. Assess pre-entry knowledge of your client. Explain the topic. Explain how the topic is related to the well-being of both the mother and fetus. After your client asks questions, you can also ask questions to ensure that your client understood what she has been taught. How to maintain group dynamics. Maintain good eye contact. Your voice must be audible. You have to pace to and fro a bit. Avoid distractions. Communicate in the language of your audience. Give brief and precise education to avoid long waiting time. Identify with the culture of your client. Avoid mannerisms. Make use of good visual aids. Include demonstration while teaching procedures. For example, preparation of oral rehydration therapy. The meaning and objective of a high vaginal swab. High vaginal swab is collection of specimen with mounted swab from the highest point of the vagina without interference with the vulva. The main objective of HVS is to collect specimen of upper vaginal discharge for laboratory investigation such as culture and sensitivity. Equipment and requisites: 1 bowl containing the sterile cotton, gauge swabs and a sterile pad, 1 kidney dish with 1 pair of sponge holding forceps and 1 pair of sterile Costco's vaginal speculum, a bowl containing sterile warm water, 1 tube for vaginal swab labeled with name and date, 1 pair of gloves in sterile package, 1 kidney dish for used swabs. Summary of Study Session 9. In Study Session 9, you have learned different types of prenatal education, diet planning, various topics you can teach your clients during prenatal education, steps in giving prenatal health education, how to maintain group dynamics while teaching a group of clients. High vaginal swab is collected for laboratory investigation. You need to maintain asepsis while collecting HVS. You should provide privacy for your patient while collecting the specimen. You have to make your patient comfortable after collecting the specimen. End of Study Session 9. Thanks for listening.